seems misinformation about COVID-19 is having very real effects, and the misinformation around vaccines in particular. It's making the jobs of healthcare workers very difficult. Doctors and nurses say it's becoming frustrating to try and treat patients who refuse to get vaccinated. They say the fatigue comes from the difficulty in trying to feel compassion for what they're calling anti-vaxxers. This is a very difficult conversation to have, so let's now unpack it with Professor Rudo Mathivha, member of the Ministerial Advisory Committee and, of course, head of intensive care medicine at Hani Baragwanath. A very, very busy professor you have with us this morning. Prof, good morning to you. Always a pleasure having you with us. And we always knew we were going to get to this point, didn't we, where we have healthcare workers who are obliged to assist, and then we have the rights of people who don't want to get the vaccine. Just tell me briefly, Professor, how bad is this?
I don't know exactly nationwide how bad it is, but it is bad in the province that I work. But the one thing that I need to point out is, as healthcare professionals and as nursing professionals, we take an oath that no matter what the patient presents with or lack of, we treat them. So yes, you might feel like you begrudge the fact that the patient didn't get vaccinated, but it just takes you back to level 1 and level 2 when nobody was vaccinated and we were treating patients.
How does it look for the workers in a situation like this? Because we're talking about this concept of compassion fatigue. Tell me about that, because you're right, there is an oath that has been taken, but what are we hoping to try and get the message across to? Is it the anti-vaxxers, as we call them, to understand the frustration of healthcare workers, Prof, or is it the healthcare workers understanding the rights of people who don't want to get a vaccine? It's a complicated moral question, isn't it?
I guess, but what are you defining as compassion fatigue? You're either compassionate or you're not. If you're not, you are indifferent. So you get two groups of people that are compassionate or are indifferent. And we are compassionate, number one, looking at the patient who hasn't vaccinated, who we hope will get through this illness, and gain him time to go and get vaccinated. And unfortunately, a lot of the patients only get it then when they're sick, that they should probably consider vaccination. As far as healthcare workers are concerned, I still have to meet a healthcare worker that is indifferent. We have not reached a space where we have depersonalized our patients. So yes, lack of compassion has been talked about in our healthcare sector for a very long time. And this was based on, if you look at the structure of our healthcare system, we have 56 million people to serve. We have less than 20,000 nurses to service that population. If you come to doctors, doctors per 100,000, per 1,000 people, we're at 0.6 or 0.9 doctors. So that is just painting you the scenario. But with all that, we try to service, especially the patients in the public sector. And when it's really wrestling, you know, when it's busy, communication drops to almost nil, And all that happens is to try and deliver therapy, And I guess to the receiving patient, that might be read as lack of compassion. Now, don't misunderstand me to be saying there isn't lack of compassion. There are a very small percentage of individuals in whom lack of compassion is inherent. And those you can identify very quickly and move them from the front line to maybe doing an admin task so that they don't interact with patients.
So it's about managing how they are able to be on the front line, also give them something of a break, move them away from that as well. It's all got to do with misinformation about vaccination. I'm sure, Prof, you'll agree, and I'm sure we can pick up this conversation again. I just want to get a sense from you about how there's this conflict, and I'm sure there's internal conflict between doctors and nurses and anti-vaxxers. But Professor, I'm sorry, I know you're very busy. All the best to you and your team at Chris Hani Baragwanath Hospital, Head of Intensive Care Medicine. You can see the kind of strain it's taking on healthcare workers, this misinformation about vaccination in South Africa.